Vertigo. What is it and what can be done about it? Firstly, what is it? Vertigo is basically this feeling of spinning. It seems like the world around you is moving. It's often referred to as dizzy spells. And it can be accompanied with certain symptoms such as feeling nauseated and wanting to vomit. They can be sweating, they can be ringing in the ears, it can actually be a loss of hearing in some cases. And depending on what the cause is and how severe it is, it can also be abnormal eye movements. So those are some of the symptoms that are associated with it, and there can be other symptoms as well, depending on what the cause is. So, what are the most common causes of vertigo? Well, number one on the list is known as BPPV, benign paroxysmal positional vertigo. This is where these basically in the ear there are these calcium deposits, these calcium crystals, and when they break away, it can cause an imbalance of fluid within the ear. It's sort of a, I guess you could refer to it as a pathological imbalance that can cause you to feel that get that feeling of dizziness. Another cause is Meniere's disease. That's believed to be caused by a buildup of fluid behind the ear. Certain infections as well of the inner ear, like vestibular neuritis, which is generally caused by viral infections, that can inflame the inner ear, and that can cause you to develop this as well. Also, like injuries to the neck and the spine and the head, tumors, migraines, certain medications like ACE inhibitors, all of these things can cause this symptom. But this it's not something that you should panic about just because you're getting it, just because you're getting the symptom. It might just be something minor, so make sure you go get it checked out and see what the actual cause is. Now, what can we do about this? That actually depends on the cause. I'm going to give you some general evidence-based, clinically proven remedies. But remember that if you don't treat the actual cause, chances are these things are not going to work. Okay, so what are the remedies? Number one on this list is something I talk about a lot, which is might actually be a little surprising to you: ginger. Now, ginger is known to be an anti-inflammatory, and it's useful for all of these GIT problems like indigestion and morning sickness and issues with the liver, and even it even helps for treating pain. But what many people don't know is that this has also been clinically proven to treat vertigo. It was used in a double-blind, placebo-controlled clinical trial, and it was able to reduce the induced vertigo symptoms in these patients. And it's very easy to use ginger. You don't have to go get a supplement of it. You can actually just mix ginger powder in hot water. And this works really well. But there's a side effect. It will give you raging hunger. So have something ready to eat as well. And so now the only downside is like if you have trouble with acid reflux or ulcers, then you're gonna want to avoid this. But ginger is a good remedy, and the clinical trial I'll be posting that in the description of this video. The next remedy is Ginkgo Biloba. This is a medicinal herb that's been used for years, I mean decades, hundreds of years, or longer actually. And it's known for its memory enhancing qualities, and it's known for giving energy. It's also known for reducing stress, at least the physiological effects of stress. And it's also known for boosting circulation, now specifically circulation to the brain. It's known for boosting cerebral blood flow. And so that, in my opinion, plays a certain role in how it can actually help with vertigo. Now, in a clinical trial, ginkgo biloba was actually compared to a drug known as beta histine. And this is one of the go-to drugs for vertigo, and it was able to do the exact same thing. However, the patients taking ginkgo biloba found that that herb was more well tolerated. So these are just general remedies. Please do figure out what the actual cause is. If you take these things and you notice that it's not helping, that's probably because there's some sort of underlying pathology that needs to be addressed. And so that's the responsible thing to do. Go get it checked out, get it addressed, and then come back to my channel or my website and see if I have any articles on that. And yeah, that's my take on vertigo. And please, if you want to get in touch with me, feel free to leave a comment in the leave a comment, or go to my website drnishal.com. I do online video call consultations, so no matter where you are in the world, you can reach me, and we can get to the bottom of whatever it is that's giving you trouble. And I'll see you in the next video.